Good morning, everyone, and thank you for joining me today. We're going to take a comprehensive look at ADHD, what it is, how it can be diagnosed, and the different ways it can be managed. Throughout this presentation, we'll explore the nature of attention deficit/hyperactivity disorder, the challenges it presents, its neurobiological underpinnings, and the most effective treatment approaches available. I'm excited to dive into this important topic with you. ADHD, or attention deficit/hyperactivity disorder, is a condition marked by ongoing symptoms that don't match what we'd expect for someone's age. These symptoms include trouble paying attention, being overly active, and acting impulsively. What's important to understand is that these behaviors are not just occasional. They are persistent and severe enough to interfere with key areas of a person's life, such as school, work, or relationships. Recognizing these core characteristics helps us better understand how ADHD impacts individuals on a daily basis. ADHD is recognized as a neurodevelopmental disorder in the DSM-5, which means it begins early in life and tends to be long-lasting. To diagnose ADHD, clinicians look for symptoms related to inattention, hyperactivity, and impulsivity. These symptoms must have appeared before the age of 12 and need to have been present for at least 6 months. Additionally, it's important that these behaviors cause significant difficulties in at least 2 different environments, such as at home and at school. Finally, the symptoms have to be more intense or frequent than what we would expect for a child's developmental stage. This combination of factors helps ensure an accurate diagnosis. When we look at the cognitive and behavioral features of ADHD, one of the key aspects is deficits in executive functions. These are higher-level cognitive processes that help us manage and regulate our thoughts and actions. Children with ADHD often have trouble with working memory, which makes it hard to hold information in mind and use it effectively. They also struggle with attention regulation, meaning it can be difficult for them to focus or stay on task. Inhibition is another challenge. This is the ability to control impulses and stop themselves from acting without thinking. Planning and emotional regulation, which involve organizing tasks and managing feelings, are also commonly affected. Another important point is the impact on academic performance. Even though children with ADHD usually have average intelligence, they often face significant challenges in school. Many of them experience specific learning disorders, up to 45%, which can make reading, spelling, or math particularly difficult. These struggles aren't due to a lack of ability, but rather the difficulties in processing and organizing information that come with ADHD. Understanding these cognitive and behavioral features helps us better support children as they navigate their academic and daily lives. When we look at children diagnosed with ADHD, it's important to understand that many of them don't just face challenges from ADHD alone. In fact, up to 80% of these kids also have one or more additional psychological disorders. These co-occurring conditions can make their symptoms more severe and create extra challenges when it comes to treatment. Recognizing these overlapping issues is crucial because it helps us tailor interventions that address the full range of difficulties the child may be experiencing, rather than treating ADHD in isolation. ADHD is a condition that impacts children across the globe, affecting about 5 to 9% regardless of their socioeconomic status or cultural background. One important aspect to note is the difference in diagnosis rates between boys and girls. Boys are diagnosed with ADHD 2 to 3 times more often than girls. This discrepancy can be partly explained by how symptoms manifest differently. Boys tend to show more hyperactive or impulsive behaviors, which are more noticeable. In contrast, girls often exhibit inattentive symptoms that are less obvious, leading to potential underdiagnosis. Understanding these differences is crucial for accurate identification and support for all children with ADHD. When we look at the causes of ADHD, genetics play a major role. Research shows that ADHD is highly heritable, with about 75% of the variability explained by genetic factors. Specific genes involved in dopamine and serotonin systems like DRD4 and DAT1 are implicated, but it's important to remember these genes interact with environmental influences, making the picture more complex. On the neurobiological side, individuals with ADHD often show delayed development in the prefrontal cortex, which can lag behind by 2 to 3 years. This area is crucial for executive functions such as attention and impulse control. Additionally, there are structural and functional differences in the frontostriatal circuits, which connect the frontal cortex with deeper brain regions involved in motivation and movement. Lastly, brain network connectivity also differs in ADHD. There tends to be altered communication between the default mode network, which is active during rest and mind wandering, and the cognitive control network, responsible for focused attention and task management. This altered connectivity may contribute to difficulties with sustained attention and self-regulation seen in ADHD. When it comes to managing ADHD, there are several effective treatments and interventions to consider. First, stimulant medications like methylphenidate and amphetamines are the most commonly used. They help reduce core symptoms by improving attention and impulse control, but their effects are temporary and require careful monitoring to ensure safety and effectiveness. Next, parent management training, or PMT, is a valuable approach that teaches parents how to manage behavior, develop coping strategies, and apply consistent discipline techniques. This can significantly reduce oppositional behaviors and improve the overall functioning of the family. Educational interventions are also important. These focus on managing classroom behavior and providing tailored instruction and accommodations that build on the child's strengths, helping them succeed academically and socially. Lastly, intensive programs like the Summer Treatment Program offer a comprehensive approach by combining medication, behavioral therapy, and social skills training, often in a camp-like setting. This immersive experience can provide significant benefits for children with ADHD. Each of these options plays a crucial role in supporting children and families affected by ADHD.